COVID-19, better known as coronavirus, has spread throughout the world. Symptoms of this respiratory disease may include fever, cough, and shortness of breath. These symptoms may show up 2 to 14 days after exposure. If you are experiencing these symptoms and have come into contact or are in an area with an ongoing outbreak, please call a hotline and/or consult with a physician. Clean and disinfect high-touch surfaces. For more information, please visit cdc.gov/COVID-19. Thank you.
Hi, I'm Dr. Betsy Greenleaf, premier pelvic health expert and women's wellness warrior. I'm the host of Sum of Your Parts podcast. As you may already know, we're interrupting our normal scheduled podcast to bring you a series on COVID-19 care, how to survive during our time of coronavirus and quarantine. I have specialists ranging from those to cover information about the virus to those on how to deal with communication, well-being, wellness, and mental health. So join me in listening to these over the next few days. Thank you. Stay well.
Dr. Tom Moorcroft is a board-certified osteopathic physician and a global leader in solving complex medical mysteries, what you might call a medical detective. His goal is to find out what's really keeping someone sick and help them get better. This involves combining the very best medical science available with his extensive experience in both the field, in the hospital, and in his office, as well as his passion for supporting health and healing with simple, everyday, and often natural approaches so you are as resilient and healthy as possible. Join me in welcoming Dr. Tom Moorcroft.
Today I have Dr. Tom Moorcroft with us. Thank you, Tom, for joining us.
Thanks for having me, Betsy. This is amazing, and welcome the opportunity to chat.
Normally you're really busy with kind of being the medical detective and figuring out people's conditions that they, can't figure out what's going on with them. And I know you have a really big specialty in like infectious disease and figuring out things with like Lyme disease and tick-borne illnesses.
Mm-hmm.
So what now with the coronavirus, what's been going on with your life, with your patients and your world having to face all this now?
Yeah, it's been I think like for a lot of people, it's been super crazy. I mean, it's all sort of the unknown. There's and a lot of what I've done over the years is we're trying to take a limited amount of research where we don't have as much information as we'd like, or we have emerging research, and try to figure out how to appropriately apply that to the person in front of us who might be suffering for years with whatever condition, this infection. And so I feel a little bit better prepared to kind of deal with the fact that it's changing on a daily basis, but it's still kind of nuts.
I know. And I was talking to you before we started filming, and you've been keeping up. So I don't even know how you're doing this. You're running your practice and you're keeping up with all the literature and posting blogs on your website and doing interviews. I don't know when you're having time to sleep with all this.
Well, it's interesting that you mentioned that, because like one of the things, everybody's like, how can I protect myself? Because it's all this like, should I take this different medicine or these herbs to get better? And I'm like, well, the first thing you need to do is really double down on all the things that you can do for yourself. And the number one thing I'm saying is adults need to be sleeping 8 or 9 hours a night, and because it's so important for our immune health and just, our body's ability to rejuvenate. And so my family and I, admittedly in the very, very beginning, we stayed up a little late talking longer. We kind of got our rhythm off a little bit. But we were still sleeping in a little longer. And now we've gotten it back, and we're really trying to focus on sleep. And you say, this is what I can get done today. And now I need to have time for some fresh air and stuff, because so critical. But yeah, I mean, there have been a few days where I'm like, wow, too many lights shining and too many interviews. But I feel so honored and blessed to be able to, to be in this place, to be able to serve and hopefully get a message of sort of calm out to everyone.
So what kind of information are you finding that we really need to know? Because right now it's so overwhelming with all the information coming from all different angles, and it's hard to kind of know what to really pay attention to. And then we're fighting the news because, hey, news stations need to sell the news, and they're sensationalizing a lot of stuff.
Right.
So what are the things that we really need to know?
Well, I think what we really need, one of the most important things is, I mean, everybody I think knows it's a big deal, and it's real, and I think we really need to take it seriously. I think in the beginning we saw a lot of information about people with 2 and 3 or more chronic medical conditions and being over 70 being at the most at risk. And while that's true, we also know from a lot of the data coming out of the CDC in the United States with our first homegrown cases, that everyone's potentially a target. If you're above 20, you could have a serious case of this. Now, the more sick you are and the more risk factors you have and the older you are, the greater your risk still appears to be. But, I wrote a blog post the other day about millennials are at risk too. And it's like, I haven't even thought about using the word millennial in a while, but it's that age group that's like running down for spring break and stuff has to really need to reassess. And for 2 main reasons. One is they could personally get sick, and it could be worse than we think. But the other part is we're finding out that there's a possibility of asymptomatic viral shedding. And so this is like, you hear a lot about the little kids are pretty steep. They're for whatever reason, lots of theories, but they're relatively safe. Our concern, though, is that they get the virus, they don't exhibit symptoms, but they can share it with someone else. Like, I have my patients are calling up and saying, I want to go, my kids are home, they finally have time, we want to go visit my parents. I'm like, wrong time to do that. And the same thing with those of us who are in our 20s, 30s, 40s. We may be relatively healthy and we don't exhibit symptoms, or they're just very mild, but we could actually we could go and give them to somebody else. So it is a period of unknown. It doesn't mean we shouldn't go out and do things, but I do think this sort of physical distancing is something that I think everybody needs to understand. It is, the horse is out of the barn at this point, so that has to be one of our focuses.
We hear a lot about flattening the curve. Can you
Mm-hmm.
explain that for us?
Yeah. And so, like if you look at all the data right now in the United States, we see this huge spike in the number of cases of the coronavirus, and especially like in New York State, or in New York City being overwhelmed. And the idea is we want to look at how many people in a period of time are sick. And so if we have a huge spike in the number of people who are sick at one time, it's much easier to overwhelm our already overburdened medical system. And so then not only are the people with new COVID-19 infections maybe not getting the best care, but also the people who are already sick or had other medical conditions can't get the care they need. So the idea of the flattening of the curve is we want to slow the spread of the disease. It's not necessarily that social distancing is going to get rid of the ultimate number of who's sick, but it's, instead of having a huge spike at one point, it's to kind of level it off and have it spread out more over time so that the system can adjust. This would also give us time maybe to come up with new vaccines. We're talking about plasma treatments, learn more about immunity, which we're learning a lot more about. So, and potentially do more studies on some of the medicine and other treatments that could help people.
I know we're kind of all of us are in this stage of panic. And, when you're panicked, there's not a lot of critical thinking going on. Everyone's just trying to do something. But I saw an article there that came out. There's a hospital very close to me, and they just released their first person from the hospital who had been treated and in ICU. And they interviewed her and her doctors, and the numbers of medications that they gave to this woman. Some of it, I'm just like, okay, I understand why, like, we don't know what's going to help, so let's give what we can. But I was surprised it seemed like they threw the kitchen sink at her. Like,
Right.
Let's give every antiviral that is known to man. And so are you seeing, I know we keep hearing different cocktails and different,
Right.
information. What kind of information have you come across that they're saying like this may work or this may not work? Or
Yeah, it's interesting. There's a lot of it. And when you first started talking about all the kind of the hysteria going on, I remember in the beginning, my daughter, Talia, she's 10, and she said, "Daddy, we need to remain calm because when our brains are going crazy, we can't think rationally or scientifically." And so definitely that's something I think we all need to apply in this situation. Unfortunately, the people who are getting sick are developing the sort of the fever and the cough sort of can come on slowly. And but then once we get the shortness of breath, a lot of the information coming out of China and even Washington state is we're seeing that it's rapid aggressive to pneumonia or pneumonitis. Also things like acute respiratory stress syndrome, sepsis, which are, really life-threatening things. So I understand why they have to throw the kitchen sink at people. And in my background, I started even before I went to medical school, I was in ER. I worked in the ER forever. I love critical care. A lot of my training, despite being, primarily family medicine, looked to go into critical care. So I spent a ton of time learning about it, and any extra time or elective I had, I was learning that stuff. And one of the things when people come in, we have to treat, our goal is to really keep them alive and treat them like our parents. And so sometimes when you don't know, you do end up doing a lot of things. And then when they stabilize, you start taking things away. In this particular situation, I think a lot of what's going on in the critical care units are being done by people who are used to working that way. We're just not used to hearing about what they're doing. So it sounds crazy, but the reality is, if you come in with sepsis to in the ER and you go to the critical care unit, you're going to get 2 or 3 IV antibiotics, maybe an antiviral. So it might be crazy, but what's really crazy to me is when we take that and we'll apply it to the vast majority of us, like chloroquine, hydroxychloroquine have looked at in severely ill people. The president talked about it, and then 90 days ago, somebody went out and they purchased chloroquine 5 from a fish store, drank it, they died. Wife, last I heard, was in critical condition and I think on a ventilator. But these are people who were just afraid, information completely out of context. So what I'm telling people, remember, we don't have good information in general about this, but all the stuff we're hearing about is in people who are severely ill. And hydroxychloroquine and azithromycin are being used for certain reasons. That doesn't mean that we should go and say, oh, anybody who thinks they have COVID-19 needs to have azithromycin, which is an antibiotic, because that's not why it's working along with the other medicine. So we're taking the context and being afraid of it. So one of the reasons those 2 medicines, chloroquine and hydroxychloroquine, may work is because they increase the cells, and they think that's making it harder for everybody's seen the COVID-19, or I should say the SARS-CoV-2 virus that caused that with the spikes on it. Well, they dock into receptors in lungs, and so they think that the docking is harder. So the kind of the union between virus and our cells is not happening as easily because pH is higher. Well, we can improve our pH by healthy lifestyle, by changing our diet and getting away from sugar processed foods. We can sleep, we can breathe better. And so I'm just saying, everybody, double down on what you can actually have control over before you start using experimental medicines that may not apply to your case.
I think that's a great point about, especially like there's so many things that we can do just for our a healthy lifestyle at this point in time. I mean, I know better, and being stuck in the house with the kids, and and probably a little panicking. I kind of made some excuses and be like, hey, I'm stressed. I deserve to eat all this candy and chocolate and cookies. And, I probably did that for a couple of days. And I go, wait a minute, this is probably the worst thing that I can do because I'm affecting my microbiome and my immune system. Like, now this is the time we really need to really focus on our healthy lifestyles.
It is. And, and this is not new information, right? And it's also very applicable to COVID-19, because if you look back at the Spanish flu epidemic, which a lot of people are kind of drawing comparisons to, osteopathic physicians had a much greater or I should say a much decreased risk of severe complications and mortality than other physicians. And there are two main things that they did differently, at least in the historical record. One is they said, open the windows and get fresh air several times a day. And obviously, if you could walk outside, preferable. But if you're so sick that you can't get outside, the family was instructed to open the windows. The second thing they did is they said, when somebody's lying down, if they're not able, get them moving around. If they can't move, we taught them to do what we call pedal pumps. So we just stand at the feet and just shake the fluids back and forth so that we could help with some mechanical movement of the lymphatic system. And these are insignificant tasks that take less than 10 minutes total twice a day. Yet they led to, some numbers I heard were up to 10-fold decreased mortality. I mean, that's amazing just by a simple supporting of the body's self-healing mechanism.
You know what? That is great. And I love that too, that to actually talk about osteopathic medicine. I love getting into that.
Yeah.
So, I wanted to ask you, because, people are panicking, especially, they hear the numbers, there's uncertainty. But it was also brought up to me recently, like, are we going to just see the numbers increasing, not just because of the cases are increasing, but are those numbers going to be artificially raised because the testing is increasing?
Right. Well, I think that both are happening. And I also think that there's probably, once we get antibody testing where we can see who's previously been infected and recover, we're going to find out that it's much, much, much bigger. So what we're doing with our testing right now is looking for active viral replication and viral shed. So we're actually trying to say who's actually sick at the moment. But I told, and we do know it's spreading faster than we had originally hoped. But also there is that, like when you look at South Korea, the numbers of cases started to get out of control and got it under control. But one of the big things they were doing is they quickly ramped up to doing 15 to 20,000 tests a day.
Wow.
Per day. And in the United States, since January 18th, we've done about 42,000 tests total.
Yeah.
So the thing is, we are so far behind. And I think overnight we had our highest jump, in new cases, something like 1,600 new cases in a day. Last 2 Fridays ago, we had 1,600 total cases. And now we're the number one in the world at 86,000 cases today. So it's interesting. And I think a lot of it is we're finally catching up with the number of cases. But unfortunately, because we were behind, if you look at Singapore, they did another thing that was really interesting that kind of helps sort of educate us in this realm. They saw what started to happen in China. So they very quickly ramped up testing. And then once they tested a positive individual, they did what was called contact tracing. And they would say, who did this person have contact with? They would quarantine all of them, but not everybody. And then they let everybody know what was going on. And they also stopped the wholesale of medical supplies. So they really quick act. And I think what we're seeing, like you said, is the numbers going up because we're finally starting to catch up. But we also have spread because we didn't identify those who were infected early enough. So it's kind of a combination of both. But I would definitely, like you were alluding to, some of the numbers are going to continue to go up. And that doesn't mean it's actually really worse. It just means we're catching up with the reality of what's on the ground already.
And I wonder with those numbers if the mortality rate is as bad as it's being reported, because we're not taking into consideration probably the people that have the virus and maybe had the sniffles or didn't have any symptoms. And that would actually drop the mortality rate statistically. So
yeah. Well, and even like 2 weeks ago, in the beginning of where the U.S. really started to emerge, our mortality rate was at 4.5%. compared to the global rate of about 3.5%. And as of today, and actually over the last week, our mortality rate's been in the right around 1.5%. So as we're looking at more mild cases, we're seeing that the mortality is lower. Now, the global death rate is still around 4.5%. And like I'm sure everybody knows, Italy is around 10%. And there's been a lot of discussion about why those things may be. But, it is important to understand that, the vast majority of people will have mild disease. And of the risk factors we know, many of them are modifiable. Like if you're a smoker or a vapor, now is a great time to stop because that is a huge risk factor for a lower respiratory illness. So smoking and vaping seems to be primarily active in the lower parts of our airways in the alveoli that we call where oxygen exchange happens because smoking damages that. Well, that's exactly where we're having damage from, COVID-19. So let's cut that out. Obesity and diet stuff are really coming out to be big things. So don't go on a crash diet, but if you're having 3 cans of soda a day, go down to 2, right? If you're having 2 candy bars, go down to 1 or 1.5. Like make small changes that you can continue to do every day because it'll make a huge difference in the end.
And, it's been funny just looking around like my neighborhood or the few times I've gotten out to drive out and the number of people that I see walking now, and if you're in a place, and cities are so much more difficult to kind of get out. But if you're in like a suburbs or the country, take advantage of, especially if the weather's nice, get out, walk around, get some exercise.
Oh yeah. Well, that's we have on our, one of the things I've been telling everybody to do is keep a routine, because getting off your routine, you can mess up your circadian rhythm. And one of the theories by why kids are doing so well is they have a lot more melatonin naturally. And this is our sleep hormone, but it's activated in the morning when we get natural sunlight and when we're outside, and then at night when it's dark. But it's very anti-inflammatory, very immune supporting. And another thing with kids they're thinking about is that you could consider they're exposed to some of the other coronaviruses that are around. So about 1/3 of all common colds are caused by coronaviruses. So they're wondering if that overlaps. But it's just interesting to think about our kids. But the other part is keeping ourselves and our kids on that routine. So we have scheduled dog walks every day, because it's like, the dogs want to get out, and I need to get off the chair and actually, get the blood flowing and stuff. So I think it's great to see people out.
It's funny. I saw a funny meme recently that had like a dog that was like passed out and was like, when is this coronavirus thing going to be over? Because it was like the dog's never been walked more in its life.
Well, yeah. Well, my dogs aren't getting more walks too because we're home during the day,
Yeah,
So,
yeah.
But it's good. I mean, I'm hoping that what we get out of this is, you hear all this stuff about how the water in Venice is cleaner and like in China, and lots of other places, the air pollution is way down. I mean, maybe it's a time that we recheck. And I've been suggesting that people just look at what they're doing and reprioritize, figure out what's most important, because this will pass and we're going to learn a lot, hopefully, and we'll change with that. But what can we learn personally so that when we're done this, we have we're doubling down now on lifelong health promoting strategies. Because if we do those right now, that's our best chance against this COVID-19 issue, but it's also our best chance to live a longer, healthier, more productive, happier life. So all the things you're doing for this pandemic are just going to translate to great habits throughout your life. So
no, I totally, that's such a great point. I did want to ask you, because I know there's always been this kind of clash between traditional medicine and like alternative medicine. And I'm seeing that even a little bit more so now. And so there's been this question about supplements and doing alternative things. And I've seen both sides of both arguments. From my standpoint, my opinion is, even though I like alternative things, I think that now this is not a virus that we've known about in the past. And I don't know if there are alternative things that we've done in the past for viruses apply to this.
Right.
But I wanted to ask you what your opinion was about supplements and alternative therapies. And
I think there's a lot out there for supplements and working and immune supporting and also antiviral supplements in people who are, we talk about 2 groups, vertical patients and horizontal patients. And vertical is most of us here, and the horizontal are the ones that are in the critical care unit who we're reading about. So most of the drug studies at the moment have been done on these horizontal people who are severely ill. And that's like when you look at elderberry, there's a lot of research to show that, well, I shouldn't say a lot. There's some research to show that elderberry may increase like interleukin 6, which is a pro-inflammatory cytokine. So basically it makes inflammation so that we can better fight off an acute infection. And then everybody jumps and says, oh, is a cytokine storm going to be a problem? But that's more for a horizontal person. But there's other evidence that shows like elderberry in particular does not have it doesn't boost up interleukin 6. So just like a lot of what we're seeing in the medicine world, a lot of our studies of herbs are kind of here and there. The things that I've been suggesting people do are the typical things, get your D at a good level, get your vitamin C primarily from food, and that's really get your micronutrients balanced out. If you're someone who generally takes some health supporting supplements in the winter around influenza time, that's fine to do. But, working your vitamin C up so much that you have diarrhea when you've been at home for a week or two is probably not necessary. And there is some research that's been going on since the original SARS outbreak, early 2000s, as well as looked at the Middle Eastern respiratory syndrome. Both of those are the two kind of previous big coronaviruses that we're aware of. That quercetin may actually be very effective. Now, they're talking about going to China and working on this. It's not really been super well tested, but that could work. But it's really hard to find quercetin now. Yeah. But the good news about that is it's relatively safe. And, a lot of people are bumping up zinc and their omegas and stuff. But my general recommendation has been, unless you're with a specific provider that has special training in this, their herbs can actually mess up your gut microbiome. They can have significant side effects. So it's not, if you're going to use these things, pick a few that you're used to and use normal doses unless you have guidance of somebody else. Because really, we're seeing that more people with mild symptoms or no symptoms are causing themselves harm by ODing on medicines or herbs than the opposite.
Yes, definitely. I know you have a lot of things to do and I don't want to keep you forever, but what kind of things do you really want us to know, or anything I didn't ask you that you would like to cover?
Yeah, sure. There's a couple of things that I think that just so people are aware of what's going on. And one is the estimates of the real numbers of COVID-19 in the US are astronomical, basically. And they're looking at models that show anywhere from 106 to like 214 million people could be infected. So don't be surprised if you see those numbers, and look at influenza, which is a seasonal virus. I mean, zillions of people are exposed, but we have years of knowing treatments. We have a vaccine that sometimes works, sometimes doesn't. But over time, if you've been vaccinated several times, that helps change the trajectory. So don't be surprised if you see the numbers go up. There are, unfortunately, also some estimates of mortality might be a lot higher than we're seeing right now. So I hope that those are inaccurate, but the numbers might go up. The other thing is there's over 80 different studies being done across the globe right now, and not just on medicine, but they're actually looking at traditional Chinese herbs and some other herbals. So the question of whether to utilize different treatments hopefully will start to be answered. In our severely ill population, they're starting to use blood products like plasma from recovered patients. This has worked in previous infections. It has not worked in others, but they're doing it in the severely ill people who don't have other options. So please don't try those things at home, but know that people are really doing the best they can. And I guess one of the other things is a lot of people talk about the vaccination, and it's just all over the place what you hear. I've heard maybe as quick as 14 months. I hear people from the vaccine industry who are really insiders who have made lots of vaccines for like the last 30 years are like 5 years, which is like, whoa. So we have a couple of different groups working on different approaches. There's one that's been going around about, using the genetics of it, and we could do it really quickly. It's worked in animals before, but not in people. So basically, people are trying to figure out what to do with the most severely ill, but don't count on us knowing a lot for a while. So what I'm recommending everybody do is most of us are going to have mild disease if we have any at all. Take a deep breath and relax. And if you think you have this, stay at home and call your doctor, because we don't want to go out and infect their whole office or whatever. And I mean, most people are putting these precautions in place. But know that when you talk to the I have a couple patients right now who may be, we have some testing pending, but we're just calling them every day to just make sure their condition doesn't change. But, just remain as calm as you can and change the things that you can change. Stay on a good sleep cycle, eat a rainbow of veggies, add a little fruit, keep your diet balanced, get outside and walk around a little, or at least open the windows, get some sunshine. And then really important is chill out. Take some time to whatever allows you to relax, whether it's prayer, meditation, yoga, drawing, writing, painting, cooking, but really take some time to savor, because, get back to enjoying the things you love. I mean, I heard a study recently on EFT tapping, where in 7 days, they can increase your immunoglobulin A levels. And that's one of the immune system antibodies that are going after infections by almost double in 7 days. And my biggest tip is pick something that we've talked about today that you enjoy, that you'll like, and do it every day for at least a week, because we know if you start today doing just something very simple that you make a habit, that will allow your immune system to work better. And really what we're dealing with are two things. We have a virus and we have a host. Let the scientists work on the virus, and if you're a scientist working on it, thank you and good luck. But you as a just sort of the general population, everybody wants to look at making themselves the worst host possible. And by being the worst host possible, it means you're the healthiest human being you can be. And model that behavior for your children, because you have so much influence over them, and we'll all get through this together.
Thank you so much for taking the time and being with us today. That is absolutely amazing.
Well, thanks for having me. I love to share, and I know that it's a challenging time, but everybody's going to get through it together, especially when everybody like yourself is giving their time to share this valuable information. So I know we're all going to make through it sooner than we hope, I think. So thanks so much for having me.
All right. I hope you and your family stay well.
Yeah, you too.
More information can be found about Dr. Tom Moorcroft at his website, originsofhealth.com. Today's episode was brought to you by the Pelvic Floor Store, your source for personal health. You can find us at www.pelvicfloorstore.com. For more information on today's episode and women's wellness, please go to drbetsygreenleaf.com.
Yeah, that's it. Yeah, that's it.